Well, all right, everyone. Welcome back to the Dr. Alex Show. And we finally got a guest in studio again. And I'm excited about this one because this is an old colleague of mine. And I'll introduce her in a sec, but I'm trying to think. This goes back to 2013, maybe 2015.
2013.
Okay. Because we were at the Fountain of Life, and then I left in 2014, and then I came back. So you were there in my initial stint?
Yep.
Okay. So anyway, this is Angel Reno, and she's a massage therapist and out of the Kansas City area. Currently, she's working at Massage Heights, and she has a lot of cool, exciting new things to talk about what's going on there. So I'm going to let her yak on about that in a sec. But figured to be a good idea to bring on a massage therapist. We've had counselors on. We've had other really smart people on, other doctors on, but haven't had a massage therapist. And since we got HML going, we had a good slew of massage therapists to work with. But then I think COVID sucked them up. Like, people got pregnant. They didn't want to go back to work. They went to work at home. Hard to get a hold of. So the idea of having Angel come on actually came in my head when we saw you over at Pearl here in Lee Summit with her husband eating. And I was like, yeah, actually doing a podcast, should have you on. Then finally got it going. So anyway, with massage therapy, we'll talk about the benefits of it and get some maybe misconceptions out of the way and just get people to understand what it is and how it can help, and even some of the cool other therapies that coincide with massage therapy that Angel will talk about, because some people are a little skittish about getting massage. So anyway, so Miss Angel Reno,
Yeah.
how's it going?
Good, Dr. Alex.
Man, that is just a trip hearing you say that, because so we started at Fountain of Life chiropractic way up north in Northland, working under Dr. Joe Knudsen, and that place at that time, so we did 2013, and then, like I said, I left and then came back, and at any given time had 2, 3, 4 chiropractors and then 3 or 4 massage therapists.
Yep.
And at one point we were rolling with such a great reputation on not only the chiropractic side, but the massage therapy side.
Yeah.
We had the best reputation for massage therapists in town, because we had you, we had the other Angel, we had Amanda, and then I think we had one other kind of sprinkled in here and there. Maybe
Christina.
Yes,
Yeah.
That's right. And everyone was awesome. People, I mean, our massage therapists were booked out. Mm-hmm. It was getting to be a problem. It was weeks on end until someone could get in, and people were coming from all over the place too.
Yeah.
So needless to say, we landed some really good ones. Since then, everyone else, I think, has found something else. But let's talk about your start with getting into massage therapy, because if I recall, this wasn't your original career, right?
Right. It wasn't. I'd been in insurance for a long, long time, 12 years or so. Thought I would want to go into nursing. So I started nursing school, and when we got to the needles, I said, nope, no way, can't do it. But I knew I was supposed to be in healing, some part of wellness. And I just kept seeing massage therapy billboards, massage therapy magazines. And, once you start seeing it, you can't unsee it.
Yep.
Went to a couple schools, interviewed, and found the one that I wanted to call home. And that's where the journey began. Graduated in 2011. Started with a franchise straight out of school, because that's what they teach you to do. And then fell upon Fountain of Life 2 years later and stayed there for about 5 years, I think it was. And then went out and ventured on my own. Thought, I'd built enough clientele that I was ready to go that venture on my own. Did that for 2 years until life kind of hit, and had to take a break from a little bit. But back into the swing of it, love it. Taught a little bit here and there. Helped build a massage program for a school in the city of Lenexa, which was huge because Lenexa really didn't have anything for massage. So we had to get that recognized and going through and approved through the city. Make sure that we followed all protocols. And Lenexa is tough. It's tough to be a massage therapist in Lenexa, believe it or not. So once we got that approved, it took probably about a good year, I want to say, to get Lenexa to approve us.
Wow.
And today that program is still up and running, and we have, or they have now, a day and a night program. And they enroll, it's an intimate size. It's about 10 is all they can handle, and that's a perfect number. But they have it booked out, and it's a 8-week program, a little over 800 hours, which survives all states right now as far as what you have to be a massage therapist. So that's been kind of one of the big aha things for my journey in massage, and now retreat director at a retreat.
That's cool. What's the school called again?
Entourage Institute of Beauty.
Okay. So they have massage there. What else do they have there?
Everything. They have massage, aesthetics, cosmetology, and nails. And they do an instructor program as well.
Okay. Now, you did that, and now you're over at Massage Heights.
Correct.
And now for people that don't know, Massage Heights is franchise?
Correct.
Okay. And then you're over at Massage Heights, Leawood.
Correct.
So still Kansas side.
Yes.
And now I understand that these Massage Heights, they're owned by the same individual. We got, what are they, 3 in town?
Oh, there's a lot more.
More?
Yeah. Actually, there's each section, I guess, is owned by a different owner. So my owner particular, he owns Shoal Creek, Tiffany Springs, Leawood, right now, and Lenexa, actually. And he's planning to get larger.
Okay.
And then there's other owners. There's a Massage Heights on College and Metcalf. So they're all over. You just got to look for them. Mm-hmm. There's Lee Summit has a Massage Heights. Ward Parkway has a Massage Heights. So they're kind of everywhere.
Awesome. Now, something I got to ask, this might be a bit of a loaded question, is when we try to find people to send like patients to go see massage therapists, sometimes they come back and they're like, man, I had an awful experience at XYZ because it's a franchise. Anything you got to say to that?
Yeah, that hurts my heart. I think the biggest thing is, the atmosphere is kind of what that place makes it. I wouldn't say that every franchise is going to be like that. I'm thankful to say that the culture we've created at Leawood, everybody that walks out of those doors, everybody has said, this feels like a family here. And it's so true. We call our therapists the back of the house, our lifestyle consultants front of the house, but there's no divide. We take care of the guests from the minute they walk in the door to the minute they walk back out of the door. And we want them to be family. I know a lot of franchises, the things you hear is that, well, they're just pushy. They want me to have a membership, the sales piece, when really that's not what we're about. Do we want you to become part of the family? 100%. But I look at more as an investment in your wellness and your health and your well-being. And that's what I strive for our location, at least, and my lifestyle consultants to understand too, is that this is something everybody should have at least once a month. We all have anxiety. We all have stress. Why wouldn't we want to take just an hour once a month, if not more? So it's really an investment in the wellness for yourself if you choose to do so. Yeah. I'm not pushing it, not going to force you into something, and certainly not going to make it hard for you to get out of it too, if you want to get out of it.
Yeah. Well, so that is a perfect answer, because I was trying to set it up. It's basically in the field of wellness, especially wellness, everything's franchised. Everything from massage therapy, there's chiropractic clinics that are franchised, right, and they get bad raps. Tanning salons, red light therapy beds, yep, places that you can just go do float therapy. I mean, it's all out there. It is all franchised. And the thing about franchises is there's nothing wrong with them, because it's allowing people to go and open up a business and get others employed to do what it is that they want to do. It's going to be as good as the people within there, like any other business.
100%.
The only difference is if you go to if we go back to like the Fountain of Life, so that was it was a chiropractor that owned it. and probably still has his blood, sweat, and tears into it. So he wants to really make sure people are leaving happy because
Right.
he was there, not every day, but he was there a lot of days. When you got a franchise, the owner of it's really looking to just be able to collect a paycheck for the most part. So it can be pretty standoffish, almost like the McDonald's experience, if you will. But as long as there's good training in place, good systems in place, and especially the right managers are in place to create that environment, it's like any other business. It can be just awesome.
Absolutely.
You know, that's for everything. It's for your Subways, it's for your McDonald's, it's for your whatever the franchise is. So that's something I just want to point out is when it comes to those, you don't need to be sitting there looking for someone, you know, doing like a private business, if you will,
Right.
to go get your work done. Like just catty corner from us is an awesome salon where they do all sorts of work. Everything that actually the school entourage teaches, they do all of it there. Go in there and you look at the prices and you're like, okay. But if you go to some smaller franchised out business of sorts that may not have all of those services, but a couple of them, you can arguably get just as good a service for fractions, pennies on the dollar.
That's a great point. It's more cost effective, honestly, when you
Yeah.
go through a franchise.
Yeah, because sometimes people bring up too, like, oh man, getting a massage is expensive. So if you go to like a day spa or a salon, or let's say a chiropractor's office that has a massage therapist, that's probably gonna be more expensive. Then where it really gets expensive in my experience is if you go to a massage therapist that has their own place,
Right.
as you probably found out.
Right.
So if you want to have some sort of storefront to have massage therapy in, it's really expensive to pay rent. So if it's franchised out and you have multiple therapists in there just to be able to make ends meet and make rent and make overhead and all that good stuff from a business standpoint, it is way more cost effective.
Right.
Way more cost effective. And quite frankly, it can really let a lot of young, eager, ready to rock therapists in the door and let them really find out if that's what they want to do. So yeah, there's nothing wrong with it. You just got to find the right one.
Right.
So
Right. Agreed.
so then you mentioned we're off mic and off camera and all that. What is it that's going on with Massage Heights? And you talked about day spa and all this.
Yeah, so I'm pretty excited. We're going to kind of switch it up a little bit because Massage Heights is known for massage. It's in the name. However, we also do facials. So we're going to change things up a little bit to where we're going to become the Heights Wellness Retreat. And so it's going to be more so on facials and massage and other therapies.
Cool.
We're looking at adding gua sha. We're looking at adding cold stone. We're looking at adding cryotherapy. You've heard of the plunge tanks.
Yeah.
Instead of plunge tanks, we're going to have a cryotherapy, basically booth.
Yeah.
And then we're going to have the LED therapy. Some touchless therapies is what we call it, quote unquote, because some people aren't quite sure they really want to go through massage. However, when you get these other benefits, you start recognizing the benefits that massage can pull into it too.
Yeah.
So I think this is going to be a really good thing. Plus, with the way the industry is going right now, I mean, in Leawood specifically, I look everywhere and you see the plunge and sauna. You know, you kind of see all the LED therapy, even at Pilates studios. They're doing LED everywhere.
Sure.
So this is now for us to take the time to game up a little bit too. And I'm real excited about these opportunities that we're going to be able to provide being a franchise.
That's cool. Is that for all the Massage Heights or?
Yes, it is. It's going to be a corporate-wide, nationwide kind of thing because there's Massage Heights all over the United States.
Yeah.
Yeah.
So then the touchless therapies, if you will, what are the examples there so people know? Because there's going to be people listening that are like, no way on the massage, but maybe these two are
Maybe
halfway
that.
interesting, so I'll keep listening.
Yeah, so like the red light therapy or the sauna. You know, you don't have to be touched for those, but you're getting the benefit. LED therapy, red light therapy, so many different things can happen with this type of therapy. On the facial side, it helps like The best description was given to me from an esthetician was, when you're laying out in the sun and the sun is depleting all those vitamins from your skin, LED therapy is actually putting that vitamin back into you by the different lights that it's using for this type of therapy. Doesn't touch you, it just lays over you, just like a hood. Also with the body, red light therapy, it can help detoxify the body, warms the body up enough to where lymph starts flowing and it gets the body nice and warm. It's been known to kind of help with weight loss as far as minimal weight loss. It's a good way to jumpstart a very healthy lifestyle habit, if you will, for nutrition. So those are a couple of them. The cryo tank that I was talking about is going to be something that you step into. I don't remember the exact temperature, but it gets really cold. We're talking like 145 something cold Celsius. And it's a 3-minute therapy. You get in, and what that does is it kind of, you've heard of how the athletes get in their ice baths. Same thing, but 3 minutes. 3 minutes just to kind of help take away some aches and pains. When you get out, it'd be great to go get a massage, warm your skins back up, or vice versa. I know way back in the day when I did some massage at some nice resorts, you would have the tanks where you would go into your cold tub, warm tub, hot tub massage, or you would go massage and go backwards to where you go hot tub, middle tub, cold tub. The difference contrast between the hot and the cold does a lot on the body and muscle tissues to either, if you're going through some sort of, let's say body treatment like, what am I thinking of right now? Body contouring. And you've kind of gone through where it's gone the ultraviolet and then it gets it warmed up and the lymph is moving and now you're moving muscle tissue. And then you do the cold globe to help remind those muscles. That's where you stay. You stay put for a little while.
Sure.
So it's kind of a nice contrast that we're adding to this and more of a retreat, if you will, experience that our guests can have.
Yeah. So you're there, which is great because for as busy as people are, it sounds counterintuitive to be like, well, that sounds great, but I'm busy. I can't take hours out of my day. Like,
you got 3 minutes?
Exactly. You got 3 minutes, or at the same rate, like, nah, it'll be okay. Why don't you actually take some time for yourself?
Yes.
Like,
yes.
Seriously, and schedule all the stuff and do it.
Yes.
And start taking care of number one, for crying out loud.
Right.
And so, real quick, that brings up this guy sitting here because I always get a question on what's the difference between these red light lasers that we use, which you probably haven't seen any of these, and like red light beds. So at HML, we use our red light. These are red light and infrared light lasers. They're LED powered. And what's unique about these lasers is in the world of lasers, you have classes 1 through 4. 1 is relatively weak. 2 is getting to be therapeutic. Then you have class A, class 3A, 3B, and 4. 4 is starting to create tissue heat, and class 4 is also used in industry. So 3A and B is relatively powerful and really the most effective. And our lasers are unique because they're FDA approved non-specific, meaning I can use this wherever I want, whenever I want, on whatever I need to do. So it's not just approved for low back pain or something like that. Now, the cool thing with these lasers, being that they're LED powered, is they're portable. Our lasers are from Shedlight, coldlasers.com, and Dr. Griswold, shout out to him, is a proud sponsor of the show, and he takes care of all of our lasers. And the biggest difference for everyone listening, because red light therapy is going to be a thing, people are they're buying panels off Amazon, they're buying things from China that apparently are lasers, they're getting their memberships to go to their red light beds, all this stuff. People ask, what's the big difference? Biggest difference is those beds utilize what's called divergent light, meaning you get in there or have a hood like around your face, where whatever you're working on, your head, even for hair growth, you have divergent light, meaning that light is scattering and it's going in multiple places. And by the time that light scatters with the power settings, it's just not going to get into the body as deep. And it's nor do you necessarily want it to, because if you were to get blasted with what's called convergent light that these have for that period of time, probably won't go well. You'll be sick because what any of the light does is the photons, you can see how deep that goes.
Yeah.
It's lighting up my hand there.
Yeah.
I don't think anyone could see this on camera, but this is shining through my hand. It's actually lighting up my blood vessels in my hand right now. What the light does, the photons will enter the body. They'll turn into electrons or run into electrons, and that kickstarts along what's called electron transport chain, big old nerdy term in the cell, to start the healing process. And that means we're going to use more oxygen, and that means we get waste and inflammation out. So it doesn't matter if we're doing panels or if we're doing more convergent light, it is going to create that effect on whatever you're shining on. Now, the biggest difference too is this means this gets in the body deeper and I get more targeted. So if we want to create detoxifying effects like those beds, I'll point this on someone's lasers, kidneys, and major lymphatic flow in their GI tract.
Yeah.
Not as efficient time-wise, but it can still get the job done. And then this can get, again, used for just about anything. But as far as what I wanted to say is it's kind of a big thing with lasers becoming more and more predominant with these beds. Now, with the beds, what I also want to point out is they're awesome. They are fantastic. The only kicker is just be aware of the bed you're getting into.
Right.
Big companies like Massage Heights, et cetera, they're going to be doing their homework and they're going to be getting the best ones. But if you're going to get a bed or a panel for yourself,
Right.
Amazon may not be your best spot
Right.
to get it, let alone a laser. Just a little heads up there, little housekeeping for everyone, because people are buying those panels and whatnot on Amazon. And when you look at the power outages or that power output and everything that those panels have, or even a bed, according to research, it's not really doing anything. So the only way you're improving is because you think you are, and that's placebo, which is just fine. But
Yeah. Agreed.
anyway, so with that aside, let's talk about massage therapy as a whole.
Okay.
So let's go into the major benefits, because we were kind of saying earlier, I mean, some people just are a little hesitant. They don't know. And again, to me, I'm like, imagine you are getting whatever amount of pressure you'd like onto your body, onto sore muscles, and just how relaxing that can be.
Right.
Like, what more of a visual do you need? But anyway, explain away, please.
Well, I think, like I said a little bit earlier too, off of this, a great mentor of mine said to me, the one way to solve world peace is if everybody could get a massage. Just think of that peace that everybody's in at that moment. I mean, and like you said, what more could you want? Massage therapy, I mean, what benefits aren't there? It's great for relaxation, stress reduce, anxiety reduce. I've worked on people with PTSD, veterans who have had severe problems coming out into the world even. They're afraid to come out because they're afraid they're going to be attacked from something. And I've worked craniosacral, which is something that is a wonderful treatment that you can use. It basically sets the body back in homeostasis and sets you rebalanced. And that's something that I've seen quite a bit with chronic PTSD clients. Children, I'll never forget one that I specifically worked at Fountain of Life, who had growth plate issues and walked on tippy toes and inverted, and with massage, just stretching. I think people forget that children need to stretch. They're constantly growing. We think just go play, they're running around, they're getting what they need, but they need that too. They need the massage, they need the stretching. Sometimes they don't know how to stretch, but her and I would play hopscotch, and just getting her to learn how to plant the feet, how they needed to be. We played tag. I'd turn on her favorite little YouTube video. It's the Moana, I think it is.
Oh, yeah.
We sit there and watch that for 30 minutes while I worked on her, and just, gave her a little massage around her joints. Within about a year, I seen tremendous results in her, and that one I will never forget. So it's getting the understanding of what does your body need? Because we're all different. We're all going through something. And we may not even know it until we finally sit down for a second and we're like, man, I didn't even realize. But just the benefits to put you in a relaxed state for an hour, 90 minutes, even 2 hours if you have the time. Once you do it, you'll come back.
Yeah.
It's one of those things that it's like potato chips. You can never eat just one. You're going to want to come back. And I just recommend it for everybody. Athletes need it. Even non-athletes need it. If you're somebody that's sedentary, works from home, sits at your desk all day, your neck, your back, I can't even imagine, the lack of circulation that you're getting in your legs from sitting all day. Massage helps with all of that. It helps with circulation. I could go forever on this. Lymph needs to flow within our body. If it's not flowing, we're stagnant. This is where a lot of aches and pains come from. Diseases come from. So there's all health just in general. Massage helps with that without being invasive, meaning back to my can't do the needle thing as a nurse. I'm actually helping somebody heal from within. And that's one of my taglines is to be whole, we have to heal within first. And you can't be that whole person that you should be. These bodies are great and they are fantastically and amazingly made, but we have to take care of them. Mm-hmm. And massage is one of the greatest, easiest things to do to take care of your body.
Absolutely. Well, and so now you're kind of getting lit up here. So I think we're getting into kind of your passion and what drives you. And I think you got to it there, which is being able to heal, which means from the inside out.
Yeah.
So I guess what specifically your passion for this? Because you said you want to be into healing, but I guess why massage?
I've never figured out why, other than
awesome.
I love the results that I see. I mean, when the person can come walking out from one session and they're like, I don't know what you did, but I feel fantastic. I'm a nerd and I want to learn everything there is to know about the body. And if you come in and it's something that I've never heard of or seen before, the first thing I'm going to do is go research it. And then I want to talk to you about it. I want to say, I could talk your ear off for days about, hey, have you tried this? What if we do this? Massage has also led me into juicing. Because of what the body needs as well.
Sure.
So, my if you were to ask me my favorite modality, I'd say all of them. I don't have a favorite because I like to use all of them too. If I know that you're coming in with a headache and it's allergy season, I'm going to do acupressure points because I've learned that and I know that. So it's all my passion. And that's probably why I get kind of fired up about it. But from the healing from within, I would say where that comes from to me is because we're, yes, manually manipulating tissue. But what happens to all the organs underneath the tissue? They're being manipulated too. They're being started up. They're being circulated again. They're having life brought back to them again. And I think that's why it's so important to understand that massage isn't just surface. It's actually healing further. It's getting circulation going. It's getting blood flow going. It's getting the body alive again.
Yeah. Well, and then, so I always got to bring things back to a neurological perspective. The second you put your hands on that person, you're immediately stimulating the brain. And for a lack of a better way of putting it, we are meant to be touched. Yeah. We are 100% meant to be touched, and that means healthy touch, hugs, massage, just any appropriate hand touching, if you will, because that immediately activates those frontal lobes. So from a neurological perspective, we go up, we stimulate going into the parietal lobes, and then that activates the frontal lobes. And when the frontal lobes get active, and the rest of the cortex for that matter, it fires on down to that hypothalamus, and then we start to get signals of decreasing cortisol, and let alone epinephrine, norepinephrine. So the major stress hormones start to drop. And then we start to get also the endorphin response.
Right.
And that's kind of the underpinnings for that. I don't know what you did to me, but I'm on cloud 9 and I hope I never come back down.
Right.
Like response. And yeah, to your point about, we're manually manipulating muscles and joints and all of that, but it's huge going into just what what it does to the connective tissue alone.
Right.
Which the connective tissue for everyone listening, the fascia, that is the wrapping of our. Well, there's fascia that wraps all organs, but we're talking about the fascia that wraps muscles, tendons, and ligaments.
Right.
And that fascia, it's this really slick surface. So it'll, if you imagine it's like a wrapping, and under that Christmas wrapping of a present, the box, if you will, is the muscle, and that box is moving, and we want it to move because it has to. Because if it doesn't, then we start to have issues. So that fascia is constantly having friction and movement, and that is signaling further lymph flow. It's signaling the nervous system. It is creating cytokine responses for the immune system. Sorry. So when you're getting massaged, you're having a full body response.
Yeah.
Just from having, let's say, the sore back worked on, and like that's just the spine. Like you had mentioned organs. You can get in there, and we do it in office. You can sit there and manipulate the abdomen and the chest to create pressure on organs. I mean, one of the biggest things we work on is constipation. Getting in there and with enough pressure, you can literally kickstart things to move again.
Yeah, you can.
And I think I'm sure you and I worked on some kids together where they were constipated. Mm-hmm. So I would adjust them, do some of that work, but then send them back to you or one of the other girls and get them worked on. But also you mentioned with kids too is, they're growing. The kids, people think like, oh, they're a kid, they don't have stress. No. Listen, go back in their shoes. We, as adults, we all say, oh, I'm so glad I'm over that stage of life. Yeah, go back to being a 12-year-old. Do you think you can handle being a 12-year-old, especially in today's society?
No, don't want to either.
No, don't want to, don't need to. I think it's safe to say in these United States, we're all kind of like, holy crap, I don't know how these kids are doing it, but they are. So they experience stress, and stress is relative. So just because a 12-year-old stress to us is nothing doesn't mean it's not something to them.
Right.
So they absolutely need it, even just from that physical standpoint of those growth pains of that one child. But then it's huge to get them to relax with, unfortunately, all these kids running around with anxiety issues that's running amok, and then attention issues alone. Having them calm down on a bed, even if they're not the most calm and the most still, getting them introduced to some good somatosensory input really goes a long way.
Well, and I think mental health has become quite a big thing here too, and just being able to get them to relax. And not that we're therapists that are going to sit there and talk through these things, but just to get them to mentally relax has really made a big improvement. Because I think I've seen that as the biggest move in our younger group today is this mental health and being aware and being cautious of, what's going on in their lives, because clearly they're stressed about something.
Yeah.
And to be able to get them to relax and not just watch TV and not be on their phones, but check out for a minute. It's okay. Mm-hmm. And to let a child know they're in a safe space to do that. And you're right, the minute you touch them with any type of illness or issue going on, just a touch can calm somebody down. And I think that's what I love the most with massage is just seeing that, just somebody breathe, because you've calmed them just by a gentle touch.
Yep. Yeah, that's no doubt. That's probably one of the most rewarding things. And it's good that you mentioned that. It's funny because like with the chiropractic work we do, at least the way we're seeing people, we want to focus on the brain and the rehab. We want to get them adjusted, and then we want to send people out for massage therapy or out for other things that take more time. So when someone comes in and they're just ready to blow, basically, they cannot breathe. They forgot how to breathe. Yeah. These people will take a breath and they'll hold it, and then I'm like, you can let it out now. You don't need it. It's okay. But yeah, they'll melt on the table. And what's interesting that I find, and I don't know, maybe you find this, is I remember when that individual, that mom would come into the office, I would initially work on them. So like, Miss Jones would come in, she'd be stressed to the gills, the kids are running around, the husband's busy, just life's crazy. She'd melt on the table, take that breath, and we would adjust, and then, or I would adjust, and then 9 times out of 10, that person, and to this day, breaks down, they cry.
Yes.
So it is, and I think part of that is because it's a fast, literally a fast healing modality. But then I'd send them back there, and then I remember asking, maybe not you, but it was Amanda at the time. I'm like, she cry on you? Did she let it out? She goes, no. She like opened up, and she was in a good mood, and I learned more about her life than I ever have. And I think that it's because you're able to take that time and let that person breathe a little bit more.
Yeah.
But it's funny because when they're on the table, it's a few minutes of getting adjusted, and it's a really powerful input. And then when that stress is instantly dissipated, it just turns into tears.
Yeah.
And most of the time it's women, but
Yeah.
I don't know if you find the same, but.
Yeah, absolutely. Emotional release is a real thing too. I see it a lot more when I do the cranial sacral work. And I think that's because it's very gentle. And it's taking that time with that person just to be and to feel what's going on in their body. And a lot of times they'll even say, I don't know why I feel this way. I don't know what's going on. And it's reminding them that you've been stressed, you've been out of the norm. And what this is doing is bringing you back into that relaxed state, that state we should be in, that homeostasis, balanced state. It's okay.
Yeah.
Let happen what's going to happen. You're in a safe space and let it happen. But that's a very real thing and very common actually in massage. And we'll get one or the other. We'll get the crying, or we'll get somebody that just all of a sudden just spills their life, and it's because they're relaxed and they feel like, I don't know why I just shared all that with you, but I did. And that's okay. You needed to at some point, and I'm glad that I was here for you for that moment.
Yeah.
So I think it's just amazing. If we could really tap into literally what's happening in that very moment, that would be huge.
Yeah. I just find it's interesting, I think, because people in the room, in the adjusting room, they'll open up a little bit, but they know they don't have an hour,
Right.
I think.
Right.
So the response is real quick, and they break down. And my whole point to that is and you started talking about it, which is the stress response. Mm-hmm. When we're stressed, it sounds counterintuitive, but it's not. We're not designed to necessarily know when we're in a distressed state.
Right.
We are meant to be highly stressed for very short periods of time and then meant to come back down. What's happening, or what happens in our society at least, is it's all the time. So then with enough cortisol and other parts of the stress response, our body becomes numb, slightly numb. We don't feel ourselves as well. And we're not as focused because our sympathetic nervous system's up.
Right.
So we're not focused on how we feel. We're not understanding how we feel. So we're not back in that place like you said. So when we experience a biochemical stress, like too much food that's just terrible for us, whether we realize it's bad or not, a physical distress, whether that's a trauma, just a really bad car wreck, or even or ongoing trauma, micro trauma, if you will, where use and abuse, sitting in a desk all day. Or if it's an emotional situation, or even a spiritual situation that is stressful, it's not your body's job, your brain's job to let you know that's going on. It's meant to keep you alive. And part of that is to keep you numb. Because let's say you have to run from your life, or run for your life, and that bear catches up to you and he just claws the bejesus out of you. Would you rather feel that in that moment or not? No, you don't want to feel it. So it's meant to numb up the pain. Mm-hmm. It's meant to get you to survive and get through it. So when you're there all the time, you don't know it.
Right.
And it's funny because people will be like, I'm not stressed. I'm like, oh, let's go down the list. Do you have a house? Yep. Making payments on it? Yep. Cars? Yep. Kids? Yeah. Wife? Significant other? Yes. Okay. They all doing stuff? Yeah. Just Okay. So, what's your usual day like? Wake up, see the kids off. Maybe I don't go to work, practices, stuff like that, all that jazz. Finally get my 30 minutes to myself, but I pass out on the couch. Yeah, sounds like you're not stressed at all. Sure.
Yeah. Yeah.
So stress is relative, people, and you're probably more stressed than you think.
Well, and unfortunately, we're not getting younger. We are getting older.
Yeah.
And we got to take care of ourselves as we go through that phase.
Yeah. Yeah, and I think that when it comes to massage therapy, let alone chiropractic, it should be part of people's lives that live in a society like this.
Yeah, agreed.
Just as much as, going to the dentist, because we're just not meant to live how we're living, and it's hard to get out of it once you're here. We're not meant to be sitting all day or being in certain positions that our Western society has us in all day long, and constant 40-plus hour work weeks and all of that. It's just not what our bodies are meant to be enduring for decades and decades. Right. So things like massage therapy exist because of that.
Right.
Absolutely. What about, so you're talking about the craniosacral. I think you should talk more about that, because people bring it up for all sorts of purposes. And when it comes to craniosacral, I've heard a massage therapist doing it. I've heard a chiro's doing it. Well, I guess that's about all I heard of, but really anyone that does any sort of hands-on therapy, I think, can learn it. Mm-hmm. So yeah, what as far as that goes, what do you got?
So in massage, we learn it pretty basic. However, I took a couple courses through the Upledger Institute, which you can go. You don't have to be a professional to take these courses, but that's like
the creme de la creme.
That is the one.
Yeah.
That is the man.
Yes.
He passed away a few years ago, but he is the one. And there's still workshops out there that you can attend, and that's the one that I would highly recommend. There's many others. Of course, you can do YouTube research, but the Upledger Institute is the top. I love cranial sacral because again, it's taking that time with the client, with the guest, and it's slowly manipulating soft tissue still, but it's very light work. It's about, like, if you were to lay a nickel on your hand, that's about the weight of the pressure that they're receiving.
Really?
It is something you want to explain to your client before you just start doing it. Otherwise, they're going to think, what is this? You're not doing anything but holding my head here. When you get pretty advanced into it, you start to feel the purpose, back up, is not only homeostasis, but to get the cerebrospinal fluid in a flow, because sometimes it gets stuck and we want it to flow. So as you get more advanced in it, when you begin your touch, you're going to feel your pulse, their pulse, and then you're going to feel a third pulse, and it's a faint pulse. And that pulse is the cerebrospinal fluid. And if it has a rhythm to it, then it's flowing correctly. If there isn't a rhythm, or it's jumpy, or it's stagnant for whatever reason, the hold is the reason you're holding. Because not only do our bodies need that, our physical body need that relaxation, but so do our internal systems. Our central nervous system needs to be relaxed too, and reminded to relax. So we're holding it as well. We're treating it as well. What I find interesting when you're just working the cranial area, as a therapist, you're recognizing the body and you're watching the body. And you'll just start to see either maybe an arm kind of start to twitch, or a leg, or a foot. And that gives me notation of, all right, I know where I got to focus on. And if it is a leg or a foot or a lower part of the body, I'm going to go to the sacrum. And everything is done under a sheet. It's not directly, I shouldn't say under a sheet. How do I want to say this? I'm not touching the person directly when I'm touching sacrum. I go all the way underneath the sheet. They're typically dressed the entire time. And I place my hands upon the sacrum, and again, I begin to feel the pulses. And I do some slow stretching away. So you're making room for that cerebrospinal fluid also to move through. Because if it's just jammed packed in your spine, it's going to get stuck every now and again. Mm-hmm. So once you start releasing the pressure and start stretching very slowly again and very mild, you'll notice that leg that was twitching just kind of stops, but it stops at a straight point like we're supposed to be. We're not supposed to be laying with our feet out or in. It stops at a very balanced state. It's it's almost magical to me to watch it happen and to feel it happen. And again, a couple of my clients that I will never forget, the first couple that I actually experimented with cranial sacral on, both had PTSD. One of them was the veteran that I spoke about. The other one was a guy that had cluster headaches, which are constant, and they just keep coming. And as they come, they get worse and worse and worse. And he said, the best way I can relieve my pain, literally, is to hit my head on a wall. I'm like, well, let's not do that. Let's see if we can relax you. The more I began to learn about cranial and working with him, you could literally start to feel the pressure in the skull, and just trying to get that to even relax. It almost felt like just fire shooting, So it's an energy technique too. You got to be open to feel, and they have to be open to feel. But the results are just phenomenal. That client came to me. Actually, he's seen me at Fountain of Life. Both of them actually seen me at Fountain of Life. And after, I want to say, with the cluster headaches, probably about 6 months in, he was lowering his medication. And that made me feel so good. Now, was he a constant? Absolutely, 100%. He's somebody I wasn't afraid to say, hey, I need to see you twice a week, 45 minutes. And then we backed it. We can kind of keep going backwards. But it's just, I did a teaching actually the other day at Massage Heights for cranial sacral. And the gal she was my model, and I was teaching about 4 others in the group, and we kind of all took turns. And when she sat up, I said, take a minute. Don't get up so fast. Take a minute. I said, how do you feel? And she goes, I feel like wired. I feel like I have so much energy. I don't know what this is, why I feel this way. And I'd watched her walk around a few days before. This is why I chose her. Mopey, just kind of slow, I wouldn't say mopey, just slow. And to see her come back and be like, whoa,
Yeah.
But she also had 5 different people's hands on her, and the energy that she was receiving, the intention for her was to make her feel better. And that's how she felt. So it's one of those things, if you've never experienced it, number one, find somebody that knows what it is and can speak it to you. But just try it. I mean, you're going to feel fantastic with it. And I think it would help children even with the growing process.
Sure.
And making sure that everything is moving just like it should be within them.
Well, and I think for a little bit here, I know I think I have that as a missing piece in our practice. One big missing piece is we haven't had a good energy-based technique. So Dr. Lauren just started learning NET, which has already been great. It's already been helping out a lot. And then yes, cranial sacral, because it's funny. There's a decent amount of people like here in town that practice it, but kind of hard to like get in.
Yeah.
Just for various reasons. But what I should say too is you started talking about the cerebral spinal fluid. So for the people that don't know, that's fluid that's within your nervous system, very distinct and special to the nervous system. When you initially just learn any of this stuff, you learn that it's just there to clean things up a little bit and lubricate the brain and the spinal cord. No, it's like everything else. We're finding out more and more. There's way more to it than we think. And this fluid, like you said, it has to move. It has to pulse, just like blood, just like lymph, just like any other fluids of the body. If it doesn't, if it's stagnant, it ain't good. So the biggest thing about this CSF is it's not that it's not being studied or not that it's not being understood. It's just that we are finding out there are way more rules to this than we think. And like you said, it's even not that it's like stuck or not flowing. It can actually get measured on imaging. It's actually something that pathologically medical doctors pay attention to when it comes to some neurological issues. But most of the time when it's noted, it's within this gray area of it's moving but not moving. Mm-hmm. And when I get that on my reports, I'm like, bingo. Yeah. This has to get dealt with for sure. Because if it doesn't, imagine having the oil in your car's engine flowing but not really flowing. Yeah. Gets a little sludgy. It's not really clean. The engine's okay, but could be happier. Yeah. And it's going to be more peppy and active and ready to go down the road, just like that lady. If it were properly taken care of.
Yeah.
So, yeah, that's awesome. I guess, I don't know if this, unless you got anything else, this might be an okay time to wrap up.
Yeah, I'm okay. Yeah.
It was really good to, I think, catch up.
Yeah.
And what this does is it makes me want to get back in the swing of things of getting a regular massage myself.
Yeah.
You have to let us know, or let me know if you do any more teachings on the craniosacral. That'd be
Yeah,
cool.
I will. Okay. Will do.
That'd be awesome to get into that. In the meantime, where can people find you?
Massage Heights Leewood on 135th and Briar, or Knoll, depending on which side you are on. Right in the little Parkway Plaza area right in there.
Cool. And then I know there's more exciting things coming down the pipe with Massage Heights. Is there any timeline on that with what you guys are going to be offering and all that?
They have given us a very large time frame of up to 2030. However, we're already in the process of making changes.
Yeah.
We've already got the go-ahead. Every quarter, we're rolling out something new.
Okay.
So the red light therapy is next. So every quarter is something new. That's a lot of stuff coming. So I think doing it quarter by quarter is the right way to do it.
Yeah.
And every location is a different size. So not every location will have everything in one spot. We're going to be able to have some at other places that are larger versus the smaller.
Yep.
So
makes sense.
Just excited. Just keep watching. If you already go online to look for us, you can already see that it's called Heights Wellness Retreat versus Massage Heights. And tell everybody it's not just a franchise.
Yeah.
I love this. The other day, a guest came in to us and she goes, "You guys are like top of the line franchise." I'm like, "Thank you. That's what I want to hear. That's what I want to hear."
Yeah, because it's really not a bad thing.
It's not.
It's like I said, it's a great way for people to have careers and for people to get access to care, because like right now, that's kind of what we're left to sending people to, because there is that thing where like, man, if you can find like a day spa and stuff, and then patients come back and they're like, man, they wanted $180 an hour. I'm like,
yeah,
I don't blame you.
Yeah,
I don't blame you. So, well, let's find the franchise, and you might have to give it, maybe you have to give it a time or two to have a therapist that you like.
Yeah, and don't be afraid to say something. Like if you didn't have a good experience, say something. It could be just that. It could be the wrong partnering with a therapist. And that's one thing that we really challenge our lifestyle consultants, that's the people at the front, to do, is to make sure that we are listening. You said deep. Was that too deep? Was it not deep enough? To make sure we pair you correctly. So don't be afraid to say something, because we want to make it right.
Yeah. And I guess what I didn't even say earlier, and I know we're getting ready to like sign off and whatnot, but it's a good point, is like, it's like finding a chiropractor.
Yeah.
Sometimes it's just not a right personality.
Yep.
There's people that came in even a couple weeks ago to our place, and I kind of got point blank period with them. I'm like, was this okay? Did you like this? They're like, yeah. And I was like, not the right personality fit. And they're like, maybe, but, and it's just, it was just hard to explain. Even their personalities were very, very eclectic, very granola and crunchy, very quote hippie. And I love and appreciate all those people, but at the same rate, it just wasn't quite right.
Yeah.
And I said, well, hey, that's fine. So here's the thing. I know some other people that you might get along with really well. They don't do exactly what we do, but you can certainly come on in for this, go see them for that.
Yeah.
And it was just fine. And that might be all that it is.
Yeah.
Because you're, as a massage therapist and a client, you're in that room with them for 30 minutes or an hour.
Yeah.
You don't want it to be awkward. Yeah.
Right.
So, yeah, absolutely. You might have to give it a few tries. Like I always say, like, do you go out to eat? Person's like, yeah. Okay. Have you had a bad experience? Yeah. Did that stop you from going out to eat? No. Okay. So keep giving it a whirl.
Keep trying.
It'll be okay.
Yeah.
And nowadays, I know that you want to go to a nice restaurant and you'll spend that amount of money on your dinner. So it's okay.
Yes. Got it. Absolutely.
Okay. Well, anything else? You got anything else?
I think I'm good.
Cool.
Yeah. Thank you for
right.
letting me be here.
Oh, it was awesome. It was good catching up.
Yeah.
I think I just need to schedule an appointment early.
Yes.
All right. All right, everyone. We'll see you next time.
All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. Shed Light Cold Lasers is, bar none, the biggest thing that has changed our practice at HML. Not only on a professional basis and the results that we are getting with our patients, because for all the professionals out there, everything from veterinarians to medical doctors to everyone in between, you can use this laser in your practice for just about anything. But on a personal basis, because what's unique about this laser is it is handheld. And if you know anything about cold lasers, a lot of times they're big, they're gaudy, you almost have to bolt them to a wall and you can't take them anywhere. This one you can take anywhere. That's because the diodes are LED, so it runs on really good lithium-ion batteries. And the other awesome feature about this, if you know anything about lasers, is that you can kind of see it on camera there. This laser has red light and infrared light. So we won't go into the details there, but just know that you got all of those features. It also comes preloaded with all of the presets to work on specific organ systems, to work on different areas of the brain, like our specialty at HML, as well as a whole host of other things that you can do with this laser. And to learn more about the lasers, head on over to shedlightcoldlasers.com, 518-338-6658, or you can email Dr. Griswold, or Griswold as I call him, shedlightinformation@gmail.com. And we want to note that you don't have to be a doc to buy these. You can be a patient, someone off the street. And Shed Light specializes in educating professionals, doctors, therapists, as well as lay public people, if you will. If they want to buy a laser, they will completely educate you on how to use it, or they will send you to a doc on the ground, someone like us, to learn how to use it. Or they'll just send you to that doctor's office, and then you can let the doc take over. Either way, they'll give you all the knowledge and information and resources you need to either get that laser or where to find one in the doc's office.